This is the lecture on postpartum psychosocial adaptations. So in this lecture, we're going to go over the psychological adaptations or the adjustments that a mother has to make after she delivers her baby. The postpartum psychological adaptation is a mental process which is related to self-adjustment of a person after childbirth. So this is pretty much how the woman who gave birth adjusts after she delivers her baby. And one of the psychological factors that can increase the risk of postpartum depression is the lack of support or the husband's role towards the wife. And also it could be the FOB. FOB is the father of the baby. If there is non-involvement of the father of the baby or the husband, that definitely predisposes the woman to becoming depressed. We're going to now take a look at the experiences of new mothers. After the delivery of the baby, there are some tasks that must be accomplished by the new mom. And so the woman needs to restore her physical condition. She needs to develop competencies in caring for her new baby. She also needs to establish relationship with her baby. And she needs to adapt to the changed lifestyle and family structure. So once a baby is in the home, it changes the whole dynamics of the family. So the patient has to now adapt to these new changes. Lack of sleep and other things that goes along with the little bundle of joy, that she has to adapt to that. So these tasks must be accomplished in order for the mom to attain to her new role as the mother. So the woman learns mothering behaviors and becomes comfortable in her new role. A process of becoming acquainted is also required in this new experience for the mom. So now during this process of becoming acquainted with the baby, there are several things that needs to be done, and that begins with bonding. So this bonding is a rapid attraction that is felt by parents for their infant. It's always a thing of joy if you ever witness a delivery. In that delivery environment, once you see the baby delivered and you see how the mom cradles the baby and how she cuddles the baby and the skin to skin, honestly, it is such a thing of joy to see how the bonding naturally happens right after the delivery of the baby. So that is that attraction that is felt by parents for their infant. And this bonding is unidirectional. And the fact that it's unidirectional means that it is from parent to the child. It is enhanced when parents and infants are permitted to touch and interact during first 30 to 60 minutes after birth. The infants are placed skin to skin for bonding time. So immediately after delivery, if the mom is stable, the mom is not bleeding, she is not in so much pain, and the baby is stable, there is no respiratory distress, there is no issues with the baby transitioning, the baby needs to be placed on mom's chest and abdomen. That is called skin to skin. The skin to skin has a lot of great benefits. It helps to enhance bonding. It also helps to stabilize the baby's respiratory rate, the heart rate, the temperature, and it helps to prevent hypoglycemia in newborn. So that is a good opportunity to initiate that bonding immediately after delivery. Delay procedures if possible in order to enhance bonding. So instead of rushing to weigh the baby, put the baby on the scale, that could be done a little later. Allow time for bonding so that you don't lose the time in initiating the bonding. And also nurses should, in terms of giving medication, and there are two newborn medications that you're going to learn about, the erythromycin and vitamin K. So if you have to hold any of these medications in order to enhance or to promote bonding, erythromycin could be given within an hour. So you can hold erythromycin, and the administration of vitamin K can actually be done while the baby is placed against mom's chest and abdomen. And studies have shown that when you administer a shot or a vaccine, a medication on a baby when the baby is held by mom, that it reduces the pain that is felt by this baby. So you could do that while the mom is bonding with the baby, but you can hold the erythromycin, which goes into the eyes. Attachment is also another task that has to be done or has to be experienced by the mom. And this is the process by which an enduring bond between a parent and child is developed through pleasurable, satisfying interaction. And this begins in pregnancy and extends for months after childbirth. The infant receives warmth, food, and security, and the mom receives enjoyment and establishes identity as the mother. So this is what that attachment involves. So this begins right from the uterus. So in utero, that attachment has already started. And of course, we have maternal touch. And this maternal touch occurs through a process of discovery. The mom and the infant, they have this kind of fingertipping going on, the initial attachment, maternal touch. You see the mom with her fingertips, touching the baby. That occurs during early minutes of life. The mom gently explores the infant's face. She looks at the baby's face. Oh my gosh, she looks like me. Or maybe she looks like my other baby at home, my other child at home. She looks like her brother, or she looks like her sister. Oh, she looks like daddy. She's exploring, looking at the baby to figure out who the baby looked like. The fingers, the toes, so all those things are, how the mom, those maternal touch, and that is how the mom tried to bond with her baby. And then she then progresses to stroke the baby's chest and legs with her palm, and is followed by what is called enfolding infant. And this enfolding is when she uses her entire hand and arms to enfold the infant and to bring her baby close to her body. So all these things are the experiences of a new mom. And this is all in the process of becoming acquainted with this new baby. Remember, she just gave birth to this baby, so she has to get used to the baby. She has to become acquainted with this baby, and she now begins to identify the features of the newborn. And also there are verbal behaviors. The mom speaks to the infant in a high-pitched voice. The verbal behaviors may provide clues to a mother's early psychological relationship to her infant. So that's why as nurses you want to pay attention to see if this mom who gave birth, is she actually adapting to her new role? How is she behaving during this period? This is the end face position. You see how the mom is looking at her baby, and she's just getting to know this baby. The maternal role attachment. There are 4 stages to maternal role attachment, and these include anticipatory stage, formal stage, informal stage, and personal stage. This role attainment happens when the mom becomes confident in her ability to care for the infant. This process begins during pregnancy and continues for several months after birth. The first one is the anticipatory stage. During this anticipatory stage, which actually begins in utero, it begins during pregnancy. This is when a mom chooses a care provider. So once she finds out she's pregnant, she's now shopping around looking for OBGYN, who will be my doctor. She chooses a care provider, and she seeks out role models and attend classes such as Lama's class, Bradley, all these classes where they teach them about pregnancy and what to expect during labor. So all those happen in the anticipatory stage. And then gradually she goes into the formal stage. And this formal stage begins with the birth of the infant and lasts for about 4 to 6 weeks. During this formal stage, the behaviors are guided by others such as healthcare professionals, close friends, and parents. She's asking questions. So what should I do when the baby is doing this? What, this baby did this last night. What was that? What do I have to do? So she's relying on guidance from others. And a major task is for the infant to become acquainted with the parents so they can mesh their caregiving cues from the infants. Now, from the formal stage, she goes into the informal stage, which kind of may overlap with the formal stage. So this begins when the mom has learned appropriate responses to their infant's cues, and now she's no longer following textbooks. So she's getting to know her baby. She knows the cues. When the baby makes a certain face, she knows, oh, maybe that means that the baby has pooped, or maybe the baby needs to eat. So now she is figuring things out. She's picking up those cues by her baby or from her baby. And then the last stage is the personal stage. This stage begins when the mother feels harmony in the role of in her role, and then she enjoys the infant and sees the infant as a central person and embraces her new role. So all these stages need to be, attained so that mom had made that smooth transition into her new role as a mom. So if you have a mom who is not making this transition adequately or making this adjustment, a mom who is complaining that she can't understand why she cannot do this, her sister did this easily and she couldn't do it, she's frustrated. Well, she's having a problem with that maternal role attainment or attachment, and such a person needs to be assessed further, because inability or unable, a mom's inability to attain this maternal role attachment or attainment can also cause depression. So you may want to keep an eye on that patient who is complaining of her inability to do certain things. If she's comparing herself with another person who have done it successfully, so that could give rise to depression. Taking in and taking hold. Well, these are other phases that these is called the Rubin's process of maternal adaptation. So this Rubin's process of maternal adaptation include 3 phases. We have the taking in phase, the taking hold phase, and the letting go phase. And so the first one there is the taking in phase. During this taking in phase, and this is usually within the first day to 2 after delivery, the mom is focused primarily on her own need for fluid, food, and sleep. She may try to take in every detail of the baby, but be content to let others make decisions. So this is the time that the mom is still wrapped up with this delivery experience. She's very passive and somewhat dependent as she sorts reality from fantasy in birth experience. So, she's still like in a daze. I can't believe I'm a mom. Oh my God, I can't believe I pushed a couple of times. The baby came out. She's still trying to let the whole thing sink in that she is now a mother. So that is usually what happens. And so the major task during this taking in phase is to integrate birth experience into reality. You see mom discussing labor and delivery and attempt to piece all the pieces together. She will be on the phone calling her friends, calling the relatives, telling everybody, oh, she's here, oh, he's here, oh my God, the baby is so cute, I cannot wait for you to see the baby. Oh, I was in labor for 3 hours. And she's just yapping away, talking about her delivery experience. That is all normal. So this phase allows mom to realize that the pregnancy is over and the newborn is now a separate individual, and it lasts within that first 1 to 2 days. So that is the taking in phase. And then we have the taking hold phase. And this is the from day 2 to 3 after delivery. And so during this taking hold phase, this is the time that the mom is ready to resume control over her life. She's now focused on baby and may need reassurance. This is the time she wants to learn more about caring for the baby. during this period. This is almost the time she's going to be discharged anyway. So she wants to know how to care for her baby. The mom becomes more independent. She starts to exhibit concern about managing her own body functions and assume responsibility for her own care. When she's more confident in her own care, she can shift attention to the infant. And so this is what happens in this phase. And this is the time that the nurse should give discharge instructions during the taking hold phase. You do not provide discharge instructions in the taking in phase, because in the taking in phase, if you are talking to the patient, giving them discharge instruction, they're not hearing what you're saying. You're probably entertaining yourself. It is in the taking hold. That is when the woman is ready. This is when the mom verbalizes her anxiety. This is the time she's like, oh, nurse, how do I know that the baby is getting enough breast milk? How do I know that the baby is doing okay when I go home? So this is the time to teach the patient. So as a nurse, you want to encourage the mom to care for the infant as well as the father. So this is the time you review materials and provide instruction for the patient. Now the final phase is the letting go phase. This is the time that the couple will continue their relationship that they had before the birth of the baby. And this is the time of relinquishment for the mother and often for the father, especially if the first child if the baby is the first child. So the couple will now give up role as a childless couple. So they have to relinquish this freedom. Some parents are disappointed by size, gender, or characteristics of infant. So they must give this, they just have to accept the reality and may have feelings of grief. So it is helpful to be able to discuss this mother, this relationship or whatever with the partner, and to return to work. All those things they have to discuss. So their life at this point now revolves around the baby. So letting go it means that the mom will no longer hang out just like the way she used to hang out with her friends, because little James is here, so she cannot go out and hang out with her friends just like she used to. That the husband or the FOB needs to be home to take care of little James. So they have to now walk around the baby. So letting go, that is what happens at home. And also they have to, make plans about their relationship and they return to work. Who is going to watch the baby while I go to work, or, who is going to do what. So all these adjustments will take place, and that is during the letting go phase. Please do not forget these phases. Postpartum blues. Postpartum blues is also known as mild depression, and this postpartum blues is often experienced by about 70 to 80% of women, and it occurs within the first few weeks, usually lasts a few days to 2 weeks. So a postpartum blues or baby blues, which is a transient period of depression, will not last longer than 2 weeks. It will usually resolve in 2 weeks. And this is usually caused by changing hormone levels, psychological adjustments, unsupportive environment, insecurity, fatigue, discomfort, overstimulation, and sometimes you have this concern about, the mom, sometimes they may be concerned about themselves. They are looking at themselves like, oh, what about this, all these changes? Will I ever get back to my normal weight? So sometimes you have that body image disturbance. The women sometimes may be concerned with regaining normal figures. So the nurses should teach that weight loss should be gradual and should teach the importance of safe activities to regain muscle. So you want to, teach the patient that those things, even if they're seeing stria gravidarum on their stomach, linea nigra, they have cloasma or pregnancy mask, those things will disappear. Remember, those things were psychological changes that happen during pregnancy. after the delivery of the baby, it will go away. You know, I had a patient who had a delivery not too long ago, and she came in with her faja. I don't know if you guys know what a faja is. Faja is like a girdle, you know, it's very prevalent among Hispanics. So she came in with her faja, but then she was disappointed because she ended up with a C-section. I wasn't going to let her put on a faja, not on my watch. I faja after a C-section. I'm like, you got to be out of your mind. She wanted to put on the faja, and this is a woman who just had a C-section, fresh post-op. I'm like, you got to be kidding me. You want to cause a freaking evisceration and dehiscence? But anyway, she became saddened because she wanted to just go back to that initial body, the body image, the way she had curls and everything. So I had to have a good talk with this patient. Definitely, she ended up with postpartum blues because, she was worried about her body image. So postpartum blues or baby blues is, it's okay. It affects about 70 to 80% of women. I went through it. You were a size 10 and you got pregnant, and now you're a size 14. Your bikini doesn't fit anymore. Your clothing doesn't fit, and you're like, oh, when am I gonna go back to this size? But then after a week or so, you're like, you know what? Life goes on. I have a beautiful daughter. I have a cute son. You can never trade that for anything, and you learn to adjust. That is what a lot of women go through. But if postpartum blues remains unresolved past 2 weeks, a woman who is still feeling low 3 weeks, 4 weeks, but now she has a full-blown depression, that is no longer postpartum blues. So remember the timing. Postpartum blues or baby blues usually resolves in 2 weeks. Signs and symptoms include tearfulness, anorexia, difficulty sleeping, feeling of let down, irritability, fatigue, and anxiety. She cries over anything. The husband says, sweetheart, I'll be home at 10 o'clock. Or 10:01, the poor man walks into the house. She yells at him. She cries over that. What is the difference between 10 and 10:01? So it's just the hormone that is going back. All the hormones are going haywire. They're trying to get back into their pre-pregnancy state. So that is what is happening, but it will resolve within 2 weeks. This is overview of postpartum depression. So it occurs within 2 to 3 weeks. So after 2 weeks, if your postpartum blues doesn't resolve, going into 3 weeks, it is no longer postpartum blues. It is now postpartum depression. The feelings last significantly longer than baby blues. There are negative feelings towards the baby, lack of pleasure in all or most activities. There is decreased appetite, loss of energy experienced, feeling withdrawn, socially isolated or unconnected. There is feelings of worthlessness or guilt, agitation and irritability, trouble sleeping, difficulty concentrating or thinking. And sometimes there are suicidal ideations. If patients exhibit signs of postpartum depression, intervention is needed immediately. Undiagnosed postpartum depression can lead to postpartum psychosis, and that can be very fatal. That is not good. So that is why we always want to screen our patients for postpartum depression and look out for those outliers, those risk factors that can predispose a woman to becoming depressed. And so this is the end of this. It's a very, very short, straightforward lecture.